Innovation, Ellen Hanson. It is only with the greatest admiration that I would like to nominate Ellen Hanson for the Nursing Excellence Award of 2015. I believe that she demonstrates excellence and innovation in her commitment to the underserved and disasters. I personally have known Ellen for 25 years, and as all of us in emergency services recognize her as a true spirit. She is an exemplary emergency nurse dedicated to the care of the patient and family. Ellen has been driven to care for patients outside of our system and even out of our country. In times of disaster, she organizes herself to respond to these emergencies and assist with her high skills. After the Haiti earthquake, she arranged a team of us from the emergency department who responded within weeks of the disaster. We were a very effective, experienced team, responding to emergencies immediately on our arrival. It was Ellen's recognition of need and past contacts that allowed her to so quickly avail our services. When Ellen returned from Liberia, the perceived Ebola crisis came to a head with American cases. Ellen is the only person with feet-on-the-ground experience with Ebola, and she became our point person, helping us to understand how we may need to care for Ebola patients in our community. She helps us to understand what the rest of us have only read about and misunderstood. She's constantly seeking opportunities to serve in underserved areas. She has responded to many of these in Africa, India, Asia, Central America, as well as volunteering at the St. Clair Health Mission here at home. Most recently, she responded to the Ebola outbreak in Liberia. She was recommended to volunteer organizationally while the epidemic was escalating. I was contacted as a reference before her travel. I could only give my highest recommendation, but did tell Ellen and the NGO that I could not advise that she travel to these Ebola camps because of the true danger of contracting this very lethal disease. Regardless, within days, Ellen was organized and on her way to Liberia, rushing in where others run away, a recognized sign of a hero. It is with these graces that I recommend Ellen Hanson for her excellence in innovation to nursing, excellence in innovations to life.
So all my life I wanted to be a nurse. When I was a little girl, I would look at my dad's National Geographic magazines and dream of helping those starving, sick kids in the pictures or those hurting families. I actually chose to go to a 2-year nursing school because I would get finished with my degree quicker and I would be able to start serving sooner. I started my career at Gunderson almost 30 years ago, and I've worked in the ER that whole time, and that ER setting has prepared me for much of the international work I've done. I'm so thankful to my ER colleagues for all that they have taught me, and I'm grateful to my managers for giving me the time off that I needed so I could go travel and serve in other countries. And I'm extremely thankful for Gunderson's commitment to improving health and well-being of global communities through a variety of projects and programs, including the Global Partners programs, which I have worked with also. I had done a variety of volunteer trips before I had heard of the need in Liberia, and I had been reading in my personal quiet time with God the story of the leper, leprosy being the untouchable disease in Bible times. And yet Jesus, when he healed the leper, he didn't speak a word of healing. He actually reached out and touched him. The next day I got a call from Samaritan's Purse in Liberia asking me to work with the Ebola patients, the untouchable disease of this day. I felt like I had to go. I needed a professional recommendation, so I asked Dr. Zernia, who I'd worked with for almost 30 years, to give me one. I had expected that my 2 weeks of volunteering in Liberia would be much like the other work I had done internationally in developing countries, and I would touch them, and they would touch me, as had happened in the past. But Liberia was so much more. I was able to share some of those unusual experiences with a variety of healthcare professionals, and also I was able to share what I had learned with Gunderson's infectious disease department and help develop a protocol for the care of potentially infected patients. My passion is international volunteer work, in third world or developing countries, but that doesn't make me anything special. We all have an opportunity each day to make a difference in someone's life. If you see an opportunity, grab that. You never know when what you think is an ordinary touch will be an extraordinary experience.